Welcome to the 2021 SAUSHEC Annual Awards Ceremony. As your dean, it's my pleasure to host you here today. And I'm really pleased that things are lightening up a little bit and we can actually get together in a room like this. And what's up with the weather? We were going to have this outside, I think, as everybody knows, and it's not raining. However, I think there's a 100% chance that we will not get rained on here. So anyway, but I'm glad we can be together. As you know, COVID-19 has forced us to do a lot of things differently, so this is not the typical venue, and generally, some of you haven't seen the way we usually do it. It's big, downtown, and we have an awards dinner also, and we hope to do that next year and get back to normalcy. We are recording the session, this ceremony live, or recording it, and I think there is a VBrick link for it. But regardless, for those who couldn't be here and you want to share, you will have that opportunity to do so. Today we're pleased to have with us Colonel Michael Wirt, the Acting Commander, Brooke Army Medical Center, and Colonel Kristen Beals, the Vice Commander of the 59th Medical Wing. Welcome and thank you for being with us here to make this a special ceremony. Together, both the BAMC and 59th Medical Wing Commanders make up the SAUSHEC Command Council, and Colonel Wirt and Colonel Beals will be presenting today's awards. Before we get started, I want to just say a few words about awards and why we take time to celebrate these accomplishments. First point I would make is that this event is bigger than celebrating award winners. It's really more of an opportunity for us to stop what we're doing and celebrate what we do here in academic military medicine at SAUSHEC. Oftentimes we're focused on the busy tasks that we have to deal with every day that you all are very familiar with. But our patients, both abroad and on the battlefield and in our stateside facilities, are why we exist. And today we're here to privilege the opportunity of serving in the educational component so that we're all prepared to care for those patients. And it's a privilege to serve in this role, and it enables the care of our patients both today and ensures that quality care will continue in the future. We here get to enjoy the opportunity to develop skills and instill values in the next generation of professionals that follow us. What an opportunity. We as faculty get to take very moldable medical school and allied health graduates and train them into specialists that are incredibly competent professionals, ready to go where our nation leads them and ready to lead medical teams. And you all, as faculty, take on this responsibility very well. And those of you who are trainees enjoy the opportunity to become experts in your field while serving your country and knowing that you are learning from those who genuinely care about your personal success. So I hope that you all take some time to reflect on that, not only today, but regularly. It's really a sacred trust given to us all by our nation, both to continually learn as best as we can to apply the knowledge and skills to our patients, and subsequently to teach and inspire those that follow us. So about the awards, in the audience are the finalists for each award category. And you all are scattered. We thought about trying to make it organized, but I think you all are seated probably where you want to be, so it will make it work. But I want to say well done for being here. It's an honor to be nominated. That means somebody recognized something that you were doing that was worthy of recognition, and that's impressive. So take pride in that, and know that you inspire all of us to do better as well. And that's coming from somebody. I've been here in San Antonio for 18 years, military, retired 2 years ago, now a civilian, and I never won a single one of these awards. So it's not about winning the awards. It's about all of us doing great work every day. So thanks for what you do. I consider all of you to be superstars. Okay, so at this point I'm going to ask the commanders to please come on stage, Colonel Wirt and Colonel Beals. And as we get started, the procedure will be, and the different speakers will announce the award categories. But you'll come on stage left and come to the middle. You'll receive the award for the recipient by your respective service commander. And no handshakes or salutes are necessary. You can do an elbow bump. And again, we're going to keep our masks on for now. We have a photographer who will be taking a photograph as well. And then exit to stage right. So let's get started. The first set of awards will be the research awards, and there's a lot of them appropriately. So SAUSHEC is an academic institution, and so it's fitting that we take the time to recognize those who have excelled in the realm of research, not only in presenting abstracts or posters, but who have also taken the final difficult step in preparing manuscripts for publication. This, as you all know, takes extra time and energy, and that's often beyond typical work hours and extending into the late hours at home to do this. So therefore, all of these awards in the research realm represent many hours of work on the part of each finalist. So I'm going to ask Dr. Michael Morris, Colonel retired U.S. Army Assistant Dean for Research and Professor of Medicine, to announce these awards. Dr. Morris.
By the way, Mark didn't mention that he is also Professor of Medicine, newly named, so congratulations, Mark. So. Hey, well, good morning. Thank you all for being here. Our first award is the House Staff Hall of Fame Award, and this is presented to the outstanding resident and outstanding fellow who have done the bulk of the work throughout their time here at BAMC and in SAUSHEC. The awardees with the most publications and research presentations are being recognized for far exceeding the SAUSHEC requirements, which is a single paper that needs to be turned into the program director. For this award, I will first announce the finalists who should stand in place to be recognized. Then I will announce the winner who will be invited to come on stage to receive the award. So for the resident category for the 2021 House Staff Hall of Fame finalists, Captain Rachel Bridwell, Emergency Medicine. Captain Devin Broadwater, Pathology. Captain Dawood Tafty, Diagnostic Radiology. And our winner is Captain Rachel Bridwell, Air Force Emergency Medicine.
We're smiling.
For the fellow category, Major Shayef Gabasha, Cardiology, Major Robert Hull, Cardiology, and Captain Joseph Marcus, Infectious Disease. And our winner is Captain Joseph Marcus, Air Force Infectious Disease. And if you don't know, their names go on a perpetual plaque downstairs by the emergency room. So it's also my distinct pleasure to showcase the talents of our graduates and announce the winners of the Commander's Research Award. And I actually did win this a long time ago. Actually, I was only third place. So this competition was actually started by Dodie Bratton from the Department of Clinical Investigation in the early 1980s. Research manuscripts from graduating residents and fellows were reviewed by a faculty panel of judges to determine our winners. The faculty reviewers from SAUSHEC programs should be commended for the difficult task of reviewing these papers. As in previous years, approximately 40 manuscripts in 6 different categories were submitted, and the titles will give you an idea of the academic and research excellence that exists within SAUSHEC. Keep in mind, all of these projects were done in the middle of demanding training programs, and in many cases, some of these manuscripts have already been published in peer-reviewed journals. For this award category, all the winners, as I announce them, should come up and get their award, okay? So the first category is Allied Health, and we have a single winner, and that's Captain Jacob Kersey, Army Emergency Medicine, and his program director is here on his behalf. And his manuscript is entitled Evaluation of Chemical Solutions Used for High-Level Disinfection of Surgical Instruments in the Austere Environment, a Benchtop Laboratory Experiment. In the category of Quality Improvement Patient Safety, the first place award is Captain Lauren Sattler, Air Force Internal Medicine. Her paper was Critical Care Education and Skills Validation Course for the Internal Medicine Physicians in the Military. In the category of Resident Primary Care, third place is awarded to Captain Jared Katchen, Air Force Radiology. And if his program director is here, if not, that's fine. His manuscript was utilizing Ensure Plus results in similar hepatobiliary syntagry, study results in patient outcome status post-cholecystectomy. Second place is awarded to Captain Michael Yu, Air Force Emergency Medicine. And his paper was Inter-Rater Agreement and Reliability of Burn Size Estimations between Emergency Physicians and the Burn Unit. In the first place is Captain Howard E. Gill, the 4th Air Force Radiology. His manuscript was entitled Technical Success of MR Elastography in a Patient Without Known Liver Disease. And as a side note, when his father graduates with you from medical school, you know you've been around for a long time. So. In the category of Resident Surgical, third place is awarded to Captain Darshan Shah, Air Force Orthopedic Surgery. Paper is entitled Translational Instability Following Cruciate Retaining Total Knee Arthroplasty. Second place is awarded to Captain Jamaica Hamilton, Air Force Obstetrics and Gynecology. Her paper was Race Matters, Maternal Morbidity in the Military Health System. And the first place winner is Captain Samuel Hobbs, Air Force Ophthalmology. Accepting on his behalf is his program director. His study is entitled The Association Between Obstructive Sleep Apnea and Cotton Wool Spots and Non-Proliferative Diabetic Retinopathy. In the category of animal or basic science research, the first place award goes to Lieutenant Colonel Eric DeSoucy, Air Force Surgery Critical Care. And his study was entitled Austere Fasciotomy, Alternative Equipment for Performance in the Field. And our last category is Fellow Clinical, and third place is awarded to Lieutenant Commander Melissa Garcia, Navy, Neonatal Perinatal Medicine. Her paper was entitled Iron Supplementation, the Risk of Bronchopulmonary Dysplasia in Extremely Low Gestational Age Newborns. Second place is awarded to Captain Subodh Arora, Air Force Sleep Medicine. His paper was Exercise Capacity is Maintained in Middle-Aged Military Personnel with Moderate to Severe Obstructive Sleep Apnea. And the first place winner is Captain Joseph Marcus, Infectious Disease. And his paper was Risk Factors Associated with COVID-19 Transmission Among U.S. Air Force Trainees in a Congregate Setting. So congratulations to all of the winners and all of those who turned in papers for us to grade. Thank you very much. I would now like to introduce Colonel Thornton Moo, Associate Dean, Army Graduate Medical Education, who will present the Outstanding Faculty Awards.
Good morning. We're going to go to my spot here.
We had bigger print for this guy.
He didn't have to use his reading glasses, if you guys noticed. All right. It is my privilege to present this year's Outstanding Faculty Awards to recognize the tireless efforts and leadership shown by SAUSHEC faculty members. For this series of awards, I will be announcing the finalists who will stand in place to be recognized. Then I will announce the winner who will be invited to come on stage to receive the award. It's the Professionalism Award, which is presented to the faculty member who exemplifies the professional delivery of healthcare manifested by accountability, excellence, integrity, service, and respect for others. Award finalists are Lieutenant Colonel Robert J. Cebulski, Jr., Pathology. Am I not reading this correctly? All right. Lieutenant Colonel Janice N. Daniel, CRNA. I don't see her. Okay. Lieutenant Colonel K. Chris McMains, Otolaryngology.
He's operating today.
They're all working. All right. Major Amy M. Moore, Emergency Medicine PA. On shift. Lieutenant Colonel Benjamin J. Morrow, Nephrology. Hey! All right. They're all at Freedom Park.
Yeah, they're at Freedom Park.
And Major Justin G. Peacock, Nuclear Medicine. I saw it. And the recipient of this year's Professionalism Award goes to Lieutenant Colonel Robert J. Cebulski, Jr., Pathology. Lieutenant Colonel Barsumian is accepting the award on his behalf. The Quality Improvement, Patient Safety, or QIPS Award recognizes a faculty member who has dedicated him or herself to identifying systemic issues in quality care and patient safety, learning lessons from these issues, and seeking iterative change to form the foundation of SAUSHEC's culture of safety. Award finalists, please stand and remain standing. Lieutenant Colonel Aaron M. Betts, Radiology. Lieutenant Colonel Robert W. Krell, Surgery.
He's deployed.
He's deployed. And Major Joseph M. Yabez, Jr., Infectious Disease. And the recipient of this year's QIPS Award goes to Lieutenant Colonel Robert W. Krell, Surgery. Accepting on his behalf, Lieutenant Colonel Clifton.
He's deployed.
The Lieutenant General Paul K. Carlton Jr. Award was named in honor of General Carlton, former 59th Medical Wing Commander and Surgeon General of the Air Force. As a general surgeon and expert in medical crisis response, his work led to the development and adoption of the Critical Care Air Transport Team, CCAT, methodology of care that is the standard of what we do today. The Carlton Award recognizes an outstanding faculty member within graduate medical education. This year's finalists are, please stand, Douglas W. Byerly, MD, Radiology. Major Amanda L. Deans, Internal Medicine. Lieutenant Colonel A. Elizabeth Markels, Infectious Disease. Jillian R. Schmitz, MD, Emergency Medicine. Lieutenant Colonel Robert J. Walter, Pulmonary Critical Care. Major Timothy J. Vreeland, Surgery. And the recipient of this year's General Carlton Award goes to Lieutenant Colonel Robert J. Walter, Pulmonary Critical Care. I'd like to now introduce Dr. T.J. Bonjour, Associate Dean, Graduate Allied Health Education, who will present several Allied Health Awards. Thank you.
Well, good morning. It is my honor to present this year's Graduate Allied Health Awards. Graduate Allied Health professionals are highly trained and skilled advanced practice providers. SAUSHEC leads the way, sponsoring the Department of Defense's largest graduate allied health training platform, developing tomorrow's leaders and medical specialists who train alongside our GME residents and who are prepared to serve in a variety of worldwide and forward-deployed military settings, complementing our core physician staff. This is the second year for our three newly named Allied Health Awards, which are named after individuals who have truly inspired our community. We are also privileged to have these individuals with us here today in the audience, and we will invite each of them on stage to present their awards to this year's winners. The Graduate Allied Health Faculty of the Year Award is named for Colonel Gerald Wayne Talcott. Colonel Talcott, please come to center stage. Colonel Talcott's service in the United States Air Force transformed education, training, and the delivery of mental health services. His impact on the clinical psychology residency and clinical health psychology postdoctoral fellowship programs at Wolford Hall Medical Center, now the Ambulatory Surgical Center, provided a professional foundation for countless trainees, shaping the character of Air Force psychology education. His innovation and foresight led to the development of the Air Force's community-based suicide prevention program and integration of mental health providers in Air Force primary care clinics, which is now the standard across the DoD and civilian healthcare settings. The Talcott Award represents how crucial and important it is to have these exemplary faculty educate and training the next generation of allied health specialists. Award finalists, as I call your name, please stand and remain standing. Major Danielle N. Anderson, Air Force Physical Therapy. Major Lance W. Camacho, Emergency Medicine, PA. Major Callie J. Cooper, Clinical Psychology Internship, Air Force. Dr. Tamika Pearson Kinsley, Clinical Health Psychology, Army. And Major David W. Robinson, CRNA. The recipient of this year's Colonel Talcott Award goes to Major Callie J. Cooper, Clinical Psychology Internship, Air Force. Thank you, Colonel Talcott. The Graduate Allied Health Trainee of the Year Award is named for Colonel Woodson Scott Jones. Dr. Jones, please join us to center stage. Colonel Jones is a retired Air Force pediatrician and former dean of SAUSHEC. Colonel Jones' vision of interdisciplinary and interprofessional education and training, integrating GME and graduate allied health education, led to the inclusion of graduate allied health becoming under the training consortium. His leadership, dedication, and innovative efforts with a synergistic approach paved the way transitioning and translating into increased collaborative education, training, and treatment in the San Antonio Military Health System. This new model also helped the medical education institution's development. The Jones Award honors the Graduate Allied Health Trainee of the Year who best exemplifies excellence, innovation, and service, extending well beyond their respective training program requirements. Award finalists, as I call your name, please stand and remain standing. Captain Corinne M. Heffernan, Occupational Therapy. Captain Robert G. Latonen III, CRNA. Dr. Genevieve M. Livingston, Clinical Health Psychology Fellow, Army. Major Mark A. Patience, Clinical Health Psychology Fellow, Air Force. Captain Lydia A. Petrovsky, Occupational Therapy. Lieutenant Rachel S. Robeck, Emergency Medicine, PA. Major Timothy J. So, Optometry. And Captain Melissa E. Woods, Clinical Health Psychology Internship, Air Force. The recipient of this year's Colonel Jones Award goes to Major Mark A. Patience, Clinical Health Psychology, Air Force. Thank you, Dr. Jones. The Graduate Allied Health Program Director of the Year Award is named for Colonel Gail D. Dial. Colonel Dial, please join us on stage. Colonel Dial is a retired Army physical therapist who helped define postgraduate training for Air Force Allied Health professionals. In 1995, he founded the Current Physical Therapy Fellowship at Brooke Army Medical Center. Established initially as a clinical residency, with his vision and work, it evolved into a dual clinical fellowship and terminal doctorate degree program affiliated with Baylor University. His work was the impetus for the creation of numerous other Baylor University-affiliated doctoral degree programs across several medical disciplines. Graduates of these programs are nationally recognized clinicians, educators, and researchers, largely because of Dr. Dial's example and commitment to educating, largely elevating clinical practice and developing leaders within the military health system. The Dial Award represents a selfless educator, creating a defined impact and influencing medicine while charting a future course for their educational program, specialty, and uniform service. Award finalists, as I call your name, please stand and remain standing. Major Christopher S. Alvarez, Optometry. Major Raymond T. Beckman, Clinical Health Psychology. Dr. Ann S. Rushko-Mullen, Clinical Health Psychology Internship. And Major Ronnie P. Robinson, Clinical Health Psychology Residency. And the recipient of this year's Colonel Dial Award is Major Christopher S. Alvarez, Primary Care Optometry. Thank you, Dr. Dial. I would now like to introduce Colonel Brian Fox, the Associate Dean, Air Force, GME, who will present the GME Program Awards.
Good morning. Our first award is named in honor of Major John Gillespie, a graduate of our BAMC Transition Year program who made the ultimate sacrifice while serving in Saudi Arabia during Operation Desert Storm in 1991. The Major Gillespie Award is presented to the SAUSHEC intern who best exemplifies excellence in medical knowledge, clinical judgment, and professionalism. Award finalists, as I call your name, please stand and remain standing. Captain Mary Beth Gadarowski, Internal Medicine. Captain Brandon Inman, Emergency Medicine. Captain Andrew W. Moulton, Pediatrics. Captain Monica M. Permalak, Obstetrics and Gynecology. Captain Catherine Thomas, Surgery. The recipient of this year's Major John H. Gillespie Award is Captain Mary Beth Gadarowski, Internal Medicine. Next is the award to honor Major David S. Berry, a dynamic young SAUSHEC pediatric faculty member who was tragically killed while on assignment in Korea in June of 2000. This award is presented to the graduating SAUSHEC resident who best exemplifies the spirit and character of Major Dave Berry, which includes superb professional competence, outstanding collegial relationships as a teacher, mentor, and consultant, and an exemplary ability to balance personal and professional life. Award finalists, as I call your name, please stand and remain standing. Captain Rachel Bridwell, Emergency Medicine. Captain Alex Clem, Surgery. Captain Crystal Foreman, Internal Medicine. Captain Susan Jacatis, Obstetrics and Gynecology. Captain Ashley Sam, Pediatrics. Captain Matthew Smith, Anesthesia. The recipient of this year's Major David S. Berry Award is Captain Matthew Smith, Anesthesiology. Next is our Outstanding Fellow Award. Colonel Nall is a retired Air Force neonatologist who his team at Wilford Hall in the 1980s and 90s developed many of the therapies which are routinely used to care for critically ill newborns today. His efforts led to the creation of the Wilford Hall Department of Defense's first neonatal extracorporeal membrane oxygenation, ECMO for short, program and the world's first transcontinental ECMO transport team. These advancements in San Antonio paved the way for this critical life-saving intervention to be broadened to transport severely injured active duty soldiers out of theater. Awards finalists, as I call your name, please stand and remain standing. Major Jeffrey Bader, Gastroenterology. Major Michael Gonzalez, Pulmonary Critical Care. Captain Robin Lombardo, Emergency Medicine Ultrasound. Lieutenant Colonel Pablo Medina Jr., Undersea and Hyperbaric Medicine. Major June Mendoza, Allergy and Immunology. And Major Zachary Weber, Neonatal Perinatal Medicine. The recipient of this year's Colonel Nall Award is Major Zachary Weber, Neonatology. Next are the awards to honor outstanding SAUSHEC program staff. There is no question in my mind that without the passionate commitment of our program coordinators and program directors, there would be no SAUSHEC. The recipients today represent the remarkable talent and expertise we have come to expect here at SAUSHEC. First is the Outstanding Program Coordinator Award, named after Ms. Ilda Benavides, a former program coordinator. She envisioned this award years ago to recognize the exceptional work and contributions as the best of our SAUSHEC program coordinators. These individuals work behind the scenes, taking care of mountains of paperwork, and handle the administrative issues which enable the training programs to run smoothly. Award finalists, as I call your name, please stand and remain standing. Ms. Beth A. Blevins, Psychology. Ms. Concepcion Conchi Cooper, Emergency Medicine. Ms. Elizabeth Saucedo, Pediatrics. And finally, Ms. Carmen Vargas, Internal Medicine. The recipient of this year's Ms. Ilda Benavides Award is Ms. Concepcion Conchi Cooper, Emergency Medicine. Our next award is a Colonel John D. Rocelli Award, named in honor of a former pediatric program director and SAUSHEC dean, a dedicated and selfless educator who was instrumental in helping build the consortium into what it is today. This award recognizes the outstanding SAUSHEC GME program director. Awards finalists, as I call your name, please stand and remain standing. Lieutenant Christopher Allam, Urology. Lieutenant Colonel Alice Barsoomian, Infectious Disease. Lieutenant Colonel Gail Heischer-Rollo, Neonatology. Lieutenant Colonel Gary Legault, Ophthalmology. Lieutenant Colonel Edward McCann, Pulmonary Critical Care. Lieutenant Colonel John McCallan, Pain Medicine. Lieutenant Colonel Candace Percival, Pediatrics. Lieutenant Colonel Brandon Proper, Surgery. The recipient of this year's Colonel John D. Rocelli Award is Lieutenant Colonel Alice Barsoomian, Infectious Disease. I would now like to introduce Colonel Jason Okulich, last year's Gold-Headed Cane Award winner, who will present this year's Gold-Headed Cane Award on behalf of the previous Gold-Headed Cane winners. Dr. Okulich.
Good morning. The Gold-Headed Cane is actually not a SAUSHEC award, but it is awarded by those who have previously been honored with the cane. The Gold-Headed Cane symbolizes the best academic medicine has to offer in three arenas that are its focus: patient care, teaching, and clinical research. The original cane was carried from 1689 until 1825 by 6 distinguished British physicians who cared for royalty. Gold-headed canes have since been given at many medical schools to singularly outstanding students. It was with this in mind that former Director of Professional Services, Dr. John Sharp, instituted the tradition at Wilford Hall in 1992, adapting it to annually honor a faculty member who represents all-around excellence, including consideration for contributions in military operational medicine. In 2009, the award expanded to include all active duty SAUSHEC faculty. You can read their full bios in the program. Nominees, as I call your name, please come to the stage to receive your medallion from your service's commander. Per social distancing guidance and small stage size, after the medallion is handed to you, please hang it over your own neck and pose for your photo. So own neck photo, okay. Then please exit the stage and line up in front of the stage facing the audience. Matthew A. Borgman, Colonel, MCUSA, Pediatric Critical Care. Representing Dr. Borgman, who was unable to join us today, is his Department Chief, Colonel Stephen Spencer. Colonel Borgman graduated from the Uniformed Services University School of Medicine in 2004. He then completed pediatric residency at SAUSHEC in 2007, followed by a fellowship in pediatric critical care at Boston Children's Hospital. He previously served as the Army consultant for medical specialists in stimulation. Colonel Borgman is currently the Chief of Inpatient Pediatrics and advisor to the Pediatric Trauma Society Research Committee and DoD Joint Trauma System on pediatric critical care issues. Our next nominee, Colonel G. Travis Clifton, Surgical Oncology. Lieutenant Colonel Clifton is a graduate of the United States Military Academy and Vanderbilt University School of Medicine. He completed general surgery residency at SAUSHEC in 2012, later followed by a 2-year surgical oncology fellowship at MD Anderson. He is currently the BAMC Service Chief for General Surgery and the Director of the Surgical Oncology Program. Lieutenant Colonel David Kvar, Vascular Surgery. Lieutenant Colonel Kvar is a 2002 USU graduate, completing his general surgery residency training at SAUSHEC in 2008 with a 1-year research fellowship at the Institute for Surgical Research. He then completed a clinical fellowship in vascular surgery at the University of Utah. He is currently a vascular surgeon at Brooke Army Medical Center, serving as the Assistant Program Director for Research and for the General Surgery Residency and the Regional Health Command Central Institutional Review Board Co-Chair. Lieutenant Colonel Joseph K. Madri, Emergency Medicine. Lieutenant Colonel Madri is a graduate of the United States Air Force Academy and received his medical degree from the Uniformed Services University. He completed his emergency medicine residency at SAUSHEC and then medical toxicology fellowship in Denver. He returned to BAMC where he served as the medical toxicologist for the emergency department. He most recently directed the United States Air Force En route Care Research Center from 2015 to 2020 and is currently the Deputy Commander, U.S. Army Institute of Surgical Research. Colonel Patrick M. Osborne, Orthopedic Surgery. Colonel Osborne is a graduate of the United States Air Force Academy and former KC-135 pilot. He earned his MD from the University of Texas in Houston and entered residency for orthopedic surgery at the University of Colorado, graduating in 2007. He is dual fellowship trained in both orthopedic trauma surgery and orthopedic foot and ankle surgery. After serving as the SAUSHEC Orthopedic Surgery Residency Program Director for several years, he is currently the BAMC Deputy Commander for Surgical Services. The recipient of this year's Gold-Headed Cane Award is Colonel Matthew A. Borgman, Pediatric Critical Care.
Congratulations to Matt. So he told me he was going to be disappointed to miss the ceremony. I think now he's going to be really disappointed. If he were here, he would tell you it's a tremendous honor, and he's humbled to win this award. Matt is a wonderful person, a great scholar, very deserving of this award. And if you read the bio, I think you'll see how, even as pediatricians, we can contribute to readiness. Most of Matt's research is combat trauma, battlefield trauma, that sort of thing. So again, thank you very much. I'll make sure he gets this, or maybe not.
So congratulations again to each of our nominees and recipients in these highly competitive categories. You're a credit to our organization, and we hope you understand how highly valued you are. This is truly a great day. Thanks also to our commanders for being here today. And also the supervisors and mentors who took the time to nominate all of you. So make sure you thank them. Very special thank you to the crew over there who made this ceremony work. So John Weber, Michelle Valdez, Linda Wiggins, Jerry Garrison, Jennifer Booker, Jana Burke, and Dave Stamper. Some of them are not here, but a lot of hands went into making this ceremony work today, and then pivot to this location at the last minute. So thank you very much. This concludes our ceremony. Thank you for joining us, and have a great day.